Yes, welcome back to the Magic Sponge podcast, a miracle cure for all your rugby league injury issues. I'm Brien. I'm the guy behind all the NRL Physio content you see on socials. My co-host James, you are here, mate. It's good to have you on a Sunday night, except I reckon this is probably my worst week of SuperCoach all season. I'm happy to fall on my sword. Jahrome Hughes going down on Thursday night. I was like, I can't quite get Cleary this week. I'll have to reverse back out. Left me with what I thought was a good captaincy option in Nico. He just absolutely shat the bed. So, mate, thankfully the Finns got 2 points via the bye because I had an absolute bludger this week. So, how'd the Bronx go, mate? They bring your week up, I'm sure.
Yeah, not a lot. I guess we lost to a red hot informed Parramatta team that were running 17th at the time, Brian. So yeah, we just ran into a good team on their good day. So, absolute, you talk about bed shits. That's bigger than a bed shit. That's like you've shot through a whole hospital ward, honestly. Like that's just insane to drop a game to a team running last. Where on paper Para are they're looking forward to next year. They are. Like that's the fact of the matter. The Broncos should have really got that done at home. There was controversy at the end, but honestly, like the Broncos bottled that. Like let's just leave it at that. And fair play to Para. They showed up and put in and they got the result where now the Broncos are sort of tediously holding on to sixth spot above the Sharks and the Dolphins, who look like they've got a much better run home. So it would have been a point where they could have made some ground up on the top four spot, but it's going to look unlikely now for the Broncos, I dare say, Brian. But yeah, good for the Finns. Got 2 more points. They're sort of hopefully cementing a top 8 spot because I think we all want to see the Finns in the finals. I know you definitely do because you're a homer, but I think everyone else does as well. Let's be fair.
Yeah, I'd love to see him have a crack, mate. It would be good. And misery loves company, mate. So we're going to keep each other company tonight, which will be good. But one thing very, very quickly, we won't keep people bored for too long. But I love your thoughts as a big Bronx man. We kind of hopped on the pod as we read this news. But, mate, old Toddy Payton special, Tom Duffy to the Bronx. That has really surprised me. I thought Kobe Black was like the next big thing there. And Tom Duffy seemed pretty – I guess cemented up there, but we know Toddy Payton can have a few specials there. So how are you feeling as a Bronx fan? Are you psyched? Are you not psyched? Where are you at, Tom Duffy? Because he's an absolute gun, apparently.
It's a great question because the fit is a bit perplexing. You think Reynolds has got one more year. Kobe Black was obviously the player of the match in the under-19s game earlier this year as well. So they've obviously touted big things for him. Whether they just feel like if Adam Reynolds did get injured next year, Tom Duffy would keep them floating above water and Kobe Black wouldn't. So maybe they think in the next 2 years, we've got this guy around. They'll probably give us a better option to win football games than Kobe Black. And if Kobe Black's still the future, maybe they feel like he needs another 2 years. I don't know. The timeline seems a bit strange to me. The roster mix looks a bit strange to me. We're probably carrying too many nines this year, and we might have too many sevens next year. I guess it's never a bad thing to have too many sevens, but it does beg the question of, what the plan is there for Kobe Black if you're coming through, you're 19, you're ready to rock, you've just been the best player in the under-19s game as well. Lots of other opportunities elsewhere as well. So I don't know why the Broncos were the one. I don't know what the thought behind that for Tom Duffy is. When you see a lot of the other opportunities kicking around the NRL, I don't know. What do you think, Brian? I guess we know how good he's been at Cup, but it is a strange fit, isn't it?
I thought it was weird. I thought there are plenty of clubs, and it's a bit like we were saying, like Toby Sexton, needing to go overseas. Like there's a lot of clubs out there who really could do for, even if they can't do with a 7, they could do with like competition for a 7. Like have a couple of guys going and like prove it kind of thing. I was actually a bit surprised initially. I was like, oh man, that would have been great for the Finns. Like get him alongside Isaiah Katoa, but then the thing that like came through was like, of course we didn't chase him because Karl Oluwapu is training with the Redcliffe Dolphins, James, and looking to make a return sometime late this season, potentially for the best Dolphins, the Redcliffe Dolphins, but then potentially an NRL Dolphins spot next year. How that dynasty league where I dropped Siwa Wong to pick up Karl Oluwapu, mate. It's all coming up Millhouse now.
You might have the last laugh there, Brian. That looked like a bad decision, but now it's looking really, really good. Really good.
We won't talk about the fact that I dropped Karl Oluwapu about 10 weeks ago. in that same league. So I might have to pick him back up. Anybody in that league listening,
Leave
don't
him
do
on
it.
waivers. Please don't do it.
Leave him for me. I will mention, mate, I had an absolute ball with the Baller Boys on Thursday night with their watch along. They're getting a lot of like streaming stuff happening for game days, particularly that first match of the round. So Thursday nights, it was, fortuitous, I guess. Obviously, really horrible to see Jahrome Hughes pop his shoulder out, and I guess we'll talk about that shortly. But I think a lot of people, it was good for them to see sort of how I do my thing in terms of analysing those injuries, getting the footage together, putting the information together, and give a little bit more insight on the go, which was good. And then like if you take that, you got the baller guys there. They're like, and we'll talk about their data tools and everything later. But it's just so good to be able to have them there with their knowledge, all their tools there. You can follow along. Mate, it's really, really cool, and they're doing some great stuff over there. So make sure you get along and watch their live watch-alongs. I think, like for me, sometimes you're just sitting there on the couch alone on a Thursday night watching the footy, so it's good to have some voices around, especially talking about SuperCoach, which is good. But, guys, we are on YouTube. Everywhere you get your podcasts, you know why you're here. One-stop shop for all things injury analysis in the NRL. We're going to loop everything back to SuperCoach Fantasy. It's head-to-head finals time. We're getting towards the end of the year. If you want to win money, whether it be the run home challenge, you're up there for the 50K, or you just want to beat your mates in head to head, we're going to help you do that. Look, let's get into the injury wrap for this week, which is brought to you by Pain Pod, drug-free pain relief anyone can use.
I don't know exactly what he's done. I would have thought it was an ankle, but I'm just guessing.
He shouldn't be out for a long period of time. I mean, I'm no doctor. We have to wait for the scans, obviously, but that'd be more positive than negative.
Round 21 is finished, Brian, so we're going to go to the HIAs as per usual. So the names on the list tonight, Chris Randall from the Titans, Wayde Egan from the Wah, Sandon Smith from the Roosters, and Toby Rudolf from the Sharkies there, Brian. A couple of names on there that have had repeat concussions in the not too distant past, hey?
Yeah, I think Wayde Egan's probably a big one. He's got a pretty extensive history of not only concussion but just a plenty of HIAs over the time. Mate, not much to talk about here. Most of these guys were Cat 1 and will more than likely miss the 11 days. The big thing I want to talk about, or I don't want to talk about, I just want to mention it in the HIAs. Mate, do you see the backup Jake Simpkin for Manly? The challenge, it failed. They didn't win.
Oh, I didn't get across the line.
Didn't get across the line.
Two down.
Yeah,
right.
I know. This is mate. It's a run. It's a run of the NRLs coming down on these challenges. Which, my goodness me, I mean, be still my beating heart, because it's all I've wanted for however long. So I mean, good to see. I'm always of the opinion, if a doctor who is neurologically trained and very experienced sees category 1 signs. And I mean, we've mentioned in the past that everywhere in the world, every professional sporting league, if there are category 1 signs, that is considered diagnostic of concussion, which means if you see category 1 signs, yes, that is a concussion because it's a clinical diagnosis. In the NRL, it's not. So that's always been a bit confusing to me. So yeah, it's good to see the NRL kind of, standing up and being like, no, a medical professional has seen those symptoms. That's what we believe. And good to see. I'll give them props when I can, mate, because it doesn't, hasn't happened very often.
Very interesting, Brian. There you go. The wind is sweeping change. Who would know? And good to see change in round 21 of all rounds as well. Rugby league loves a late round backflip, don't they, on refereeing things or interpretations on things. So just another one for the history books there for the NRL backflip on. We're going to talk shoulder dislocations now, Brian. So I'll spit that out a little bit more effectively. We're going to talk about 3 guys on the list here who are probably the 3 biggest names out of round 21 in terms of injuries, in terms of their shoulder dislocations. So first one from the Storm was Jahrome Hughes. Second from the Bunnies was Tevita Tatola. And then the last one was Haumole Olakauatu, who we've obviously spoke at length about on the sponge in the past. But I'll just throw the floor straight to you here, Brian, because there's a bit to get through for these guys. All had slightly different mechanisms, I suppose, but all, prognostically, are going to have some similarities and some differences as well there, and some few interesting tidbits for the nerds playing along at home as well.
Yeah, mate, I think we usually do team by team, but we're going to talk about the same things over and over again for these three guys. So figured may as well just put them all in together and then talk about shoulder dislocations as a whole, just to educate people in kind of what we're dealing with here. So Jahrome Hughes was the first one. So his mechanism, arm hung out to the side. Now, whether it dislocated with the arm hung out to the side and getting swept back, because that is a position that that can cause shoulder dislocations. I think a lot of people thought it was a pec. And what I'll say is that mechanisms for pecs and shoulders very, very similar, particularly with that kind of tackling out away from the body. It kind of, because of the way that the shoulder dislocates is out the front. So like, that's where the pec is as well, so it puts pressure in through there. Or if Jahrome popped it out when he landed on his arm, either way. So popped it out, they couldn't get back in on the field or in the shed, so he had to go to hospital. So thankfully for him, he's had scans. There's no fracture there. They're hoping to rehab and for him to be back in 6 weeks. I'll get back to that in a second. Just run through Tevita Tatola. He had the tri-scorers mechanism, which is probably the most common mechanism we see for shoulder dislocations, which is landing on an outstretched arm, called a tri-scorer mechanism because often you see it when guys are scoring tries, the arm out like that. So he's yet to go for scans, or is going for scans, and we'll get an update on him. And then Olakauatu, he has redislocated in his first game back. Probably the most innocuous mechanism of the lot, I guess you could say, in terms of he seemed to be making just a fairly regulation tackle and just copped a knock directly on the shoulder. I wouldn't call that a typical shoulder dislocation mechanism, in that if that happened in isolation, he had no history, I wouldn't go straight to shoulder dislocation. But obviously it didn't take as much to pop out because he has avoided surgery and come back. So he took 6 weeks off, has returned. Seibold said in the post-match presser that their physio said to them that there was about a 90% risk of Olakauatu popping his shoulder out again, considering, their assessments and scans and all that kind of stuff. But they decided to take the risk effectively. Now let's talk about, there's so many things to talk about here. I'll try and keep it as short as possible. It's not my strong suit, but I'll see how I go. So I guess with Jahrome Hughes, and he's probably the biggest name in terms of moving forward. In terms of Supercoach Fantasy, he's absolutely a sell because he's not going to be back before 6 weeks for a full dislocation. I've seen a lot of people quoting Nathan Cleary last year, who had, I think it was a 3 or 4 week return for the round one of finals, or the first week of finals. That was only in a subluxation. So that's where it didn't shift fully out or pop fully out of the socket. It just shifted. He'd had a few of those subluxations last year, but it was only a subluxation. So it doesn't shift as much, doesn't cause as much damage or as much instability. So he can come back a bit quicker. Whereas, with Jahrome, he's going to be 6 weeks. So that's definitely out of the question. Now, in terms of kind of surgical versus non-surgical, what are the things that determine that? The biggest one is fracture. If there is a fracture there in the ball and socket, usually in the socket is the main concern, kind of where the ball sits in there. If there is a fracture there, there are very, very rare cases where you can play through that. All of the others, though, it's kind of a bit of gray area, right? So whether it be cartilage, whether it be ligament, or even cuff, rotator cuff, there are some. Jonathan Thurston famously, has played through a few double cuff injuries in his time. It is a lot harder to do with a cuff, a rotator cuff, because that's the musculature, and that obviously, moves things around. So it really limits your function. Whereas with your ligament and your cartilage, it's more like re-injury risk. It makes it more unstable and those kind of things. But even Jahrome Hughes, they're saying, the scans are good. He's, looking to return in 6 weeks. It just the risk is still at least, 50% that he's going to redislocate it. He will more than likely have reconstruction surgery post-season, because all of these guys, and we can talk about Olakauatu, Jahrome Hughes, and Tatola in this, after they have a reconstruction, the redislocation rate is really, really low. It's below 10%. And depending on the surgical type, so a Latarjet, for example, you hear us talk about every now and then, which is like a bone graft kind of surgery, it's below 5% is the redislocation rate. So it's really, really low. So the thing I would say is that surgery obviously fixes it up really well, but it leaves it obviously takes 12 weeks recovery. So it ends your season. So that's why guys are a bit hesitant to go there straight away unless they absolutely have to. People have asked a little bit about what are the risks playing on. So not only for Jahrome Hughes, but then Olakauatu redislocating it. What are your risks for playing on? Is it a, no risk? You got to get the same surgery anyway. And I actually had a patient this week who I had to, have this discussion with. He had 2 games left in his year 12. He's in year 12. He's got 2 games left. He's got a big cartilage tear, ligament tear, all those kind of things. His functions returned pretty well over the last 3-4 weeks. And he's like, but I've got to get the same surgery after the year anyway. Why don't I just play? But it's bringing up that every time that shoulder pops out again, there's risk for further damage. So he has no cuff damage at the moment, this patient that I'm seeing. But if his shoulder pops out or he cops another knock and the cartilage isn't doing its job, that could potentially damage his cuff. And then it's a more extensive surgery. It's sometimes a 2-procedure surgery. So similar sort of thing here for these guys is that whatever damage they have at the moment, every time that shoulder dislocates again, your risk is just more damage. And someone like, a Sam Burgess or a Michael Morgan, they saw the worst case scenario of this where it then that further damage, because both of those guys played through recurrent shoulder instability over and over again. It got to the point where the bone wear and tear was so much that they had to retire, right? So that's the extreme end, obviously. But it's not zero risk, I think, is what I'm getting at here. So I think overall, Olakauatu is looking at surgery more than likely. Siebes said as much in the post-match, and that's kind of where we're at. We've seen like a Toby Couchman. He's had 3 instability events this year, and he's still trying to come back. That's kind of rare. Like you usually, I think the saying from most surgeons that I talk to is you get 1 for free. So you get 1 dislocation for free. And then once you've had more than 1, it's kind of like, we've got to go under the knife. And look, these guys are obviously playing for Sheep Station, so it's a little bit more grey area. But once you've got multiple dislocations, it's pretty tough to avoid surgery. So I think for Olakauatu, he's probably going to get surgery. It'll be at least 3 months, potentially 5, depending on how much damage is there, but he'll be fine for next year. And as he said, low redislocation rate. Tevita Tatola, it'll depend what they come back with. And then Jahrome Hughes, 6 weeks. And then we've seen, and I think the biggest thing with someone like Jahrome Hughes, a bit similar to like a Jahrome Luai and Nathan Cleary, who have come back from this injury in previous seasons and not redislocated it, it is easier for halves to come back than forwards, right? Because they don't have to make as much, they don't have as much contact in their game. They don't have to make as many tackles. So their risk is inherently lower that they're going to pop it out again. And halves can kind of hide themselves in the defensive line. Though we've seen that time and time again. So his redislocation risk is still elevated significantly for the rest of the season. And they're going to have to carry someone on the bench to cover them. And they've already got Wishart, but that's what, I think Panthers didn't they carry Brad Schneider on the bench last year after Cleary came back? I'm pretty sure. So, that's the way they've got to approach it. The redislocation risk is still quite high. Performance-wise, you're not expecting too much effect there. But then postseason, get the surgery and come back next year nice and fresh. Mate, I've rambled on for a lot. I tried to fit as much in there as I can. Have I missed anything that you can think of in terms of like questions people may have?
No, you've done well. I think the 2 that just come to my mind, Brian, is just when, a medical staff says, look, it's a 90% risk of redislocation for Haumole. Seems quite bizarre that they'd run the gauntlet on that, just given where they're situated. I know they are in touch with the 8, but then if you think you're going to get a guy like that through multiple weeks, like maybe that timeline needed to go back a bit further. I don't know. It just seems bizarre to me. If Siebes quoted 90%, that's pretty damning sort of assessment from a physio perspective. So I guess that would be confusing as well. And the other one I was just curious about as well, which, not really a question to you, but for Jahrome Hughes, it's very rare that you see people have to go to hospital to get their shoulder relocated. Because in the NRL, I can think of many videos that we've seen where guys get their shoulder pop back in. The one that probably jumps out to my mind is favourite of ours, Cody Nikorima from the Bronx, behind the dead ball line. Like one of the great videos that he gets his shoulder relocated almost within 10 seconds was one of the more unbelievable things you've ever seen. But given that his X-ray is clean, so there might not be any bony block or intra-articular thing that explains why they couldn't get it back in. That seems surprising to me. So I don't know what's happening behind the scenes there. I don't know what the scan results are there, but yeah, we don't see that very often that they cannot relocate a guy's shoulder either on field or in sheds to the point where they have to do it in hospital under maybe more anesthetic. I don't know. That just seems a bit bizarre to me. So maybe, that probably does put him at high risk of being more on that 6-week return to play timeline. Maybe the Storm, if they get a top 2, there might be a week off consideration in there as well, I guess. But yeah, it's going to be a tricky one for the Storm to navigate, isn't it? I guess, probably not much else for you to add there, to be honest, mate.
The only thing I'd say
those
on
questions,
that, on the popping it back in, now on the spot, I'm forgetting the player, but do you remember the club posted, I think it was Jacob Host, now that I think of it.
Yeah, it was the Bunnies.
The
In
Bunnies,
sheds,
and they and they
with the Nico stick in his mouth.
Oh,
Yeah,
man,
that was wild. Yeah.
So
There's a few,
it
that's the
goes.
thing. You think about those ones when they do them in the sheds pretty routinely, and Jacob Host was, like, quite
Oh,
audible.
yeah.
Like, you hear the sound of it relocating, and you see him gritting down on the teeth with 2 guys holding his arm so he couldn't sort of fight back. But, yeah, Jacob Host was one. I think Cody on the field was definitely one as well, but I think a lot of people will probably, recognise it and realise it when they bring up those 2 things. So, yeah, just an interesting point to take away
The
from that
only
as
thing
well.
I'd say is like often that muscle spasm can get quite significant, so that's a thing. But there's different, techniques. I was talking to a sports doc the other night talking about like the scapular manipulation technique and those kind of things. So there's ways to get around that. But yeah, no, definitely rare to see it need to go to hospital. That's for sure.
Yeah, for sure. Righto, we'll move on to the games proper, Brian. So Roosters vs Storm was next on the list. 2 guys out of this game with shoulder injuries as well, were Nick Meaney and Egan Butcher. Don't know anything about status of these guys. What have you got for us?
Yeah, so Nick Meaney was the try scorer's mechanism. So he scored that
Yes,
try
yeah,
and was
right,
out
yeah.
and got that little sublux, what it was at the time, because he obviously stayed on and stuff like that. But yeah, there was when I first saw it, I'm like, oh boy, are we having 2 shoulder dislocations in a game here? That could be not good. So with a subluxation, as we said before, it doesn't come completely out of the socket. So a bit similar to Dylan Lucas earlier in the year, where it just leaves him a little bit more susceptible, increased risk of redislocation or instability event moving forward, but doesn't necessarily require a lengthy timeout. Like a lot of guys are back in 1 to 3 weeks, with a 1 week return being like he's back next week and doesn't miss any time. So just like a little bit of an elevated re-injury risk. And then Egan Butcher, mate, I found the mechanism for him. He got absolutely lit up by Eli Katoa in one, like a full on like AC joint, like, or potentially glenohumeral if it was bad enough, but more like an AC joint pain kind of shoulder whack right to the shoulder. So I assume he went off, painkillers, those kind of things. So he might be back next week. But there could be a higher grade injury there, which would be like that 2 to 4 week range. So we'll wait to hear the scan results there.
Nice update, Brian. We'll move on to the Cowboys versus the Dragons next. So 3 names on the list. Jaydn Su'A with a knee concern, looked like an MCL injury there. Jack Belin with a rib issue, and Corey Allen with an eye injury. Brian, my sneaky point of difference, Queensland Spirit holder Jaydn Su'A, this is not good for my fantasy team. This is the last thing I needed, seeing obviously Dill Lucas and Keon being subbed out of my second row recently with bugger all trades. Do you think we're looking at back this year for Jaydn Su'A? It's probably touch and go, isn't it?
Yeah, mate. Shout out the Dragons. Actually, I've spoken about the Storm and their distaste for me in the DMs in recent times. But mate, Dragons, one of the few clubs who I have a wonderful relationship with, and they're very very great with communication and those kind of things. So unfortunately, I have heard that Jaydn Su'A, they're thinking about 6 weeks for him. So that. Not ideal. They were still getting scans last I spoke, but that moderate to high grade. Now, why you're a bit worried about that is because their hands-on tests are really accurate, James, as you would know. Like with an MCL injury, there's a specific stress test that we do, and we can feel how much give that test has, and that's pretty accurate in us kind of deciding, oh yeah, there's there's a partial or a complete tear here, because with a grade 1 injury, which is minor, they're going to get pain with that test, but there's not going to be laxity or looseness. So when we push the knee that way, it's not going to give. It's still going to be nice and solid, but they're going to go, ow, that's painful. And you're like, okay, more than likely a grade 1. So we haven't lost any, like we don't have any extra movement, but it's painful, more than likely a grade 1. But once you get to the point where it's pretty sloppy and loose. And I mean, you and I have spoken about in the past about like ACL stress tests that we see on the TV and we're like, oh man, that's loose as. So similar sort of thing here with the MCL. So I think 6 weeks, yeah, it's sounding like season over at this point, unfortunately for Su'A, which would, yeah, be a massive blow. Jack de Belin with the rib, he has been managing it. I mean, the way it was put to me, you know, like half our team is playing with stuff at the moment. So Luciano Leilua also has a rib issue, you know, these kind of things. So yeah, this time of the year, there's not many guys not playing through stuff. Corey Allen copped a poke in the eye, but he apparently improved the day after the game. So should be okay from here. But yeah, unfortunately, mate, I think one of your 2 final trades might have to be on Jaydn Su'A.
Yeah, it's a bit sad, Brian, isn't it? And a pretty crappy mechanism, hey. That tackle is just like, you know, we talk about it week in and week out, but it's just not a good thing when you see guys hit at that height in someone's knees like that and cause that stress. Broncos versus Eels was next. So yeah, probably a bit sad for me to update this game because it was a tough watch as a bloody Broncos fan. Tell you that for free. But the names on the list. So we've got Isaiah Iongi was a hand fracture ruled out by the Eels pre-game. So he's probably about a 4-week or 5-week on the sideline. I think, Brian, was what you quoted. Te Kura was a foot injury that was ruled out pre-game as well. And then Payne Haas was nursing ice on his left medial ankle, I think, in this game. So very difficult to see a mechanism. I don't think there's been anything come out of the Broncos. It looks like they've taken Payne Haas's injury status to ground. Did your eagle eyes see anything about Payne Haas there, Brian? He's obviously highly rostered for SuperCoach, isn't he?
Mate, this is this was a special, this one, because obviously I think if anyone's in the broadcast channel, I covered it pretty extensively at the time. In terms of, when I say covered it pretty extensively, covered how little we could figure out about it, because the video of the incident, his foot passes behind a player just as it happens. So you see pretty much nothing. And then there's no other views. I did hear from people at the ground that even the Bronx docs couldn't get good video of it either. So it must have just been one of those ones where it was just off camera, those kind of things. So it looked like potentially it was like just an ankle roll, like a lateral ankle sprain. They can be really painful, but not require a lengthy time. But then, as you say, that the ice was on the inner side of the ankle, which starts to make you think, did he cop a knock? Did someone kick him? Is it a high ankle sprain? Really don't know. And then, Madge in the post-match presser, I think the words were his body is a bit temperamental at the moment or something. And I'm like, yeah, okay, Madge.
It's one of the worst adjectives you could use to describe an NRL player's body. Temperamental is not it.
So I'm like, I get that he's
enormously resilient and robust, yes, and worldy, yes, but temperamental's fucking bizarre.
Throbber, some would say.
Throbber, yeah, you could say that. Lots better. Let's say that.
Yeah, come on. But I understand he's got this back thing that he's dealing with, and that might be a bit temperamental. But this was, obviously a bit more than that. So I wish I had more, but literally, there's just by the sounds of it, the Broncos docs are even a bit miffed in terms of the presentation, and then the video, they couldn't really find anything. So they didn't seem too concerned post game from the little bit that we got out of Madge and the guys in the sheds and those kind of things. So hopefully it's nothing. But one of those ones we're just going to have to wait and see. Iongi out for 4 weeks with the hand fracture, and Te Kura with the foot fracture. The main reason I wanted to mention him is, mate, just totally lost on me. I just lost track of him because I think he returned via Q Cup. He had a 5-week return to play from that syndesmosis surgery that he had, mate. So Arthrex just getting shit done with that tightrope, because that's for someone his size. I remember he had that Liz Frank injury last year, I was like, take whatever the Liz Frank recovery is and add 4 to 6 weeks onto it, because a guy his size, it's just there's so much force coming down. It's going to be a real tough rehab. I would have said the same thing for this like I, dealing with a high ankle, I'm like, oh man, pushed it out to 8 to 10 weeks. A 5-week return to play, that is seriously impressive. So well done to the Bronx and to him because, I mean, he might be going to NFL. I'm not sure if you read that story today, but
No, I didn't. No.
yeah, mate, there was a story today that he's being scouted by NFL clubs. So, a lot going on there. But, just shout out Ben Te Kura.
Yeah, he's a big bit of gear, isn't he, Ben Te Kura? I guess it would be probably the world's biggest tightrope as well, going through his syndesmosis. Imagine the size of that thing in diameter. It's probably 30 centimeters across the middle. It'd be absolutely enormous. Warriors v Titans was the next one there, Brian. It's a bit of a boil over here by the old Titans. I was backing the Warriors in to put up plenty with Roger in my centre wing spot. But out of this game, Demetric Vaimauga was hard to tell if it was a knee or an ankle concern. Again, another hip drop mechanism type tackle there that explained his injury. Then Cody Capes with a shoulder injury. And then Erin Clark here, Control-C, Control-V with cramping yet again. Probably just a same old story for Erin Clark, isn't it, Brian, with the minutes there?
Mate, like I feel like it's almost a meme, including him, but I get so many messages about him every week. Like people freak out because they see him limping off, and I went back and checked, and it's cramps again. The man cannot stop cramping.
He can cramp.
Oh, yeah. Mate, like we made the joke about the Botox last week. I reckon he's got to get something to sort out those pins, mate. They are those baby cows are not happy with him. Come the 65th minute, he is that. I tell you what they should do is they should learn their lesson and play him like 60 straight and then just let him have the last 20 off, I reckon, because whatever they're doing at the moment, it's not working for him at all. He's cramping up hardcore. So Cody Capes has got some sort of ongoing shoulder issue that he's dealing with. Not really sure what's going on there. And then Vaimauga, another yuck tackle, hip drop. It can be knee or ankle and can be pretty significant. He played out the last minute and a half, but that's not that doesn't fill me with confidence that he's avoided anything there, because we know both MCL and syndesmosis issues, you can kind of play out the game and then find out once it cools down that's not great. So I'm a bit worried that we're going to get some bad news on Vaimauga over the next 48 hours.
Yeah, it does seem like it's probably going to be a bad news update there. And he's been playing really good footy there, and a few of the Wires have been as well. Obviously, they didn't get the chocolates on the weekend, but they're going pretty good. Panthers Tigers was next. So Tigers aren't going so good. And Latu Fainu has been ruled as an arm injury out of this one. I haven't heard anything in terms of severity, but that's bad news for the Tigers. He's one they can ill afford to lose. And then Scotty Sorensen, this was an absolute belter there in the broadcast channel, Brian. This was pre-game. What injury he's been ruled out with, who knows? I think, what was your quote? I've got it in front of me, and I think it said, Ivan Cleary, this is. He's got a something. He's not too bad. He should be back next week, hopefully. So Panthers just keeping all the injuries in-house there. One of the great rugby league presser quotes. He's got a he'll be back next week. All good. He's got something. Just you can imagine what he's got. Just fill in the gaps. One of the greats. That was good.
Boy. Yeah, and look, props to Penrith, right? They and I say again, if I was in an NRL club, I would give nothing away. Why? Yeah. I would give nothing. I speak, whenever I speak about it, I speak from the position of a fan sitting on the couch. That's what I am at the end of the day. Because, I totally understand. If I'm not required to give any information away as a medical practitioner, there's no way I'm giving it away. I don't care. I just want to win games and I want to keep the mystery. So, props to him. But, also, screw you, because from fans' point of view, we love to know about these things. I heard back. I heard calf. I had a lot this week. So, maybe he's back this week. Who knows? Latu Fainu copped a knock to the arm. Once again, the video wasn't great because it was zoomed out. It looked like it was a Liam Martin knee directly to the forearm. So I'm a bit worried. Hopefully it's just a bad cork, but I'm a bit worried potentially for a fracture there. So that's probably not good. Latu Fainu was playing lock for some reason at that stage, which, James, I love Benji, one of my favorite players of all time, but what are you doing, champ? Just keep Latu Fainu at 7, I think, at this point in time. But we'll wait and see on that one.
Good update, Ryan. Let's go to the Rabbitohs v the Sharkies. So we always have a Rabbitoh on this list, and this week is no different. Euan Aitken's listed here with a hamstring injury. And then Anfanua Blake, not really very specific here, Brian, but leg injury. He's sort of been hobbled for many, many weeks now. It feels like even going back to pre-buys because we talked about him as not being an option over the buy period. And then lastly, Siosifa Talakai was ruled out pre-game with an illness as well. So he was sort of a midweek, late week rule out with illness pre-game, wasn't he?
Yeah, so he had the flu or something pretty bad, and they gave him up right up to the game and couldn't make it. So, yeah, he was out. Adam Fanua-Blake, mate, I've got heaps of questions on him in terms of people going, what's going on? Does he need weeks off? Blah, blah, blah. Look, he copped a cork a couple of weeks ago, and then he copped it almost was a hip drop, but then, yeah, I think they got a knee to the ground first. So he's just copped a couple of, really bad knocks. He had that thing earlier in the year, which was the groin, which kind of held him back. So I think he's just had bad luck in a few games from what I can tell. So I don't think, he came back onto the field, but obviously if you cop a knock and I sort of saw that ankle look like it, it had that little syndesmosis kind of, twist to it a little bit. That's going to limit your output for the rest of that game, particularly. So, yeah, I don't think there's anything long-term with AFB, but he's just had a pretty nasty few weeks. Mate, Euan Aitken came on to the field for this game with his hamstring strapped like a mummy. It was strapped from top to toe, big black strapping. And, mate, he was clutching at it hard for the last, few minutes of the game. I thought if I didn't know any better, I was like, oh, yeah, he's torn it because he was grabbing at it. And I'm like, oh, maybe it's a cramp, but he had this hamstring issue a few weeks ago. And the one thing that I wonder is whether this is a Payne Haas situation and it's his back, because Euan Aitken's one of the first players that I can remember since I started covering NRL Physio, because that was late 2017. I think it was late 2018 or early 2019. Euan Aitken spoke about getting an epidural in his back to help with his ongoing hamstring issues because he's having repeated hamstring issues, and he got the epidural in his back and it completely fixed everything. And he hasn't really had anything hamstring issue wise since then. So I wonder whether, because he stayed on even after clutching the hamstring. So I'm like, I wonder whether there's a back component there is the only thing, which would not concern me long-term, a bit like your, Payne Haas's and stuff like that. Might just mean an early shower here and there because he aggravates it, those kind of things.
Yeah, good summary, Brian. The next game was the Raiders versus the Knights. Bradman Best was the name on here with a knee concern. He was ruled out pre-game. Hard to sort of tell in terms of severity here, Brian. They're talking about, patella instability for him, aren't they?
Yeah, they said a ligament that holds the patella in place, which, as you and I probably know, is the MPFL, which is a medial ligament in the knee. The mechanism did look like it was medial stress, so MCL, MPFL kind of go hand in hand a little bit with those ones. He was in a brace during the week, which kind of usually for me, I had a few physios. I can't remember who I sent that about. Oh, it was Haumole Olakauatu. I said, look, because Haumole Olakauatu was in a brace a week after suffering his knee injury. And I was like, look, unlikely to be kind of a minor MCL sprain if it's still in a brace. And all these physios into me, I still put minor MCL sprains in braces, which for me, number one, I can't remember the last time I've done that. But number two, if I do it, it's for 2 to 3 days max, certainly not a week. And with Bradman Best, he was still in a brace come Thursday. So for me, that usually means instability is still there, which usually means a grade 2 kind of injury, which usually means multiple weeks on the sideline. So I think the Knights were pretty adamant he's due back next week, but I've got my doubts at this point in time. So, and then if he's got that kneecap instability issue, look at Haumole Olakauatu, mate. He's had multiple aggravations this year, multiple early showers had to come off. So that's a similar sort of thing with Bradman moving forward, I think.
Yeah, totally agree with you there, Brian. The Knights, I should say, are fairly unappealing for fantasy moving forward, aren't they? A lot of injuries stacking up there now. Bulldogs vs Manly, last game of the round. So Tom Trbojevic named here with a knee concern and Bronson Xerri with a nose injury. I haven't got any details here, Brian. I missed this game actually, so no surprise to see the Manly boys come out totally unprepared though, getting bathed 42 points to 4. That's for sure.
Mate, Anthony Seibold, another special. Turbo just got bent awkwardly, cleared of any knee issue, and Bronson Xerri had a broken nose, so nothing big there either. So I think they both should be fine.
Play on then to the NRLW. So we're going to name a few people here for the NRLW. Casey Ray, Brooke Anderson, and Stephanie Faulkner were concussions out of this one. Brien Sahara Tamara was a hamstring injury. Indy Bostock there, who's flying down there for the Dragons with a finger concern. Shakira Baker with a pec injury, and Emily Curtin with a hip injury. Brien, anything super interesting that you want to touch on for those gals in the NRLW?
Nothing really, mate. No, I think, like another week of nothing too crazy at this point in time with the NRLW, which is fantastic. I think we're doing pretty well in the NRLW, and I don't want to curse it, but long may it continue, mate. So, hopefully nothing too major moving forward.
Yeah, fingers crossed there, Brien. So let's go through to the questions that people submitted through the broadcast channel. So thank you again, as always, for submitting them through the broadcast channel. We're just going to launch straight in there now with wrapped injuries. So question 1, what do you think about Cam Murray maybe coming back this season for the Bunnies? So surely considering that Souths are on the bottom of the ladder as it stands at the moment, they were just going to maybe push him back till next year. What's doing with this talk about him coming back this year? It seems wild to me, Brien.
Yeah, mate, like very, very strange. I mean, we were kind of freaking out when we heard about the infection, right? Like we were going, "Oh my God, like what's what are we going to do here like for next year, let alone this year?" So like props to him that he's obviously rehabbed the house down and is looking really, really good at this point in time. I think he's about 5 months post surgery now, which is great. But yeah, I just don't see the upside, James. Like Wayne was saying, if that's what Cam wants to reward himself with after, working really hard for the last like 6 months. But like, yeah, I guess my gut feel would be like this year you're not really playing for much. So surely you just say to your player, look, I know you've worked really hard, but let's kill it next year. We've seen, time and time again with players over the time, that their performance, their re-injury risk, all those kind of things are just so much better leaving it, especially for a full off season, like having that off season to build the performance, build your fitness, all those kind of things. Kevin Durant's a wonderful example, like in another sport from the NBA, like taking that extra time for his recovery. It just like he came back so well. He no re-injury there with the Achilles. So re-injury isn't super high with Achilles, but yeah, I just rushing him back. Like maybe it's this kangaroo tour at the end of the year. He wants to try and prove his fitness for that. But a real puzzling one for me. I think we talk about risk reward on this show all the time. But yeah, I just don't. Yeah, like I don't see the upside personally. Where are you at with it, mate?
Yeah, don't understand either, to be honest. There's nothing to play for the Bunnies as it stands at the moment. And you look at the rest of the team they'd be carrying as well. There's, Lockie Hubner's a fairly good 13 there. He can play big minutes. He's done enough this year. I think he's worthy of keeping the 13 on his back. And, what's the upside? He might be trying to get a free flight to Europe with the Kangaroos team, maybe, Brien. So maybe it's a little Euro trip there for Cam Murray. But I think even, with Kevin Walters at the helm now, Brien, I think Kevy would probably take him sight unseen. I wouldn't say that for sure, because who knows what Kevy's going to do there in that squad. But it's sort of a team that picks itself, right? There's not really too many surprises come end of year, unless Kevy Walters goes totally rogue and picks his son on the bench or something like that. There could be some things like that in play. So might be one to wait and see. Question number 2 is, over in the Super League, we're going to ask, did you see David Armstrong's injury where he played maybe 3 or so games with a torn ACL? Was it possible that, was it Lee Leopards, I think he plays for, they didn't know about what was going on there?
Yeah, I think I had a look. I actually reached out to David himself because I saw his post and I was like, oh man, like I just wanted to say like, so sorry to hear about the injury and like that was crazy. And he kind of sent me through some footage of when he'd suffered the injuries and those kind of things. So I think he had an initial injury where he hurt his knee and he had 3 weeks off and then returned. Then he played 3 games, then he hurt it again. And it was kind of like, yeah, like, the first straw and then the final straw kind of thing. And looking at the mechanisms, I think because he had, by reports, ACL and PCL damage, it looks like that first game where he suffered the injury was more like knee into the ground, which is that classic PCL kind of mechanism. And the fact he was able to come back 3 weeks later, the medical staff have assessed his knee and gone, oh, it's a PCL injury. Let's bring him back in 3 games, brought him back. While it's rare, it does increase your risk of other damage to, other structures in the knee. So he's obviously, I think the last mechanism, that final straw, was that classic ACL, like deceleration, change of direction. So you're never going to know. And we've said, we call these the Schrodinger's ACL or the Schrodinger's knee, where the Schrodinger's cat is you don't know if the cat's dead or alive until you open the box. We don't know whether the ACL was torn because they didn't get it scanned. And I've heard from a few ex-players that maybe the medical stuff over there isn't as thorough in terms of scanning and those kind of things. I remember I heard from one ex-player once who told me that they played through, went and got scans themselves to find out that he'd ruptured his ACL, but he was playing for a contract. So just kind of said, oh yeah, no, I think I've just jarred my knee, give me a couple of weeks off, and then came back and made sure he got the contract and just kept playing. I think he only had 1 year left, kept playing, those kind of things. So I'm not sure if that's still what it's like. I'm obviously not over there dealing with any of it, but so that's kind of what I think has happened there.
Yeah, good update there, Brien. Question 3 is about Matty Nicholson and Toby Couchman. They're due back soon from injury. Are you expecting reduced minutes for them to start off with?
Yeah, I think so. I think Matty Nicholson, as much as anything, coming back from injury, but the Raiders forwards are so stacked. They won't need to play him 80 minutes, I don't think, to start with. So, yeah, expecting limited there. And then Toby Couchman, it a bit falls into the Cam Murray thing for me, mate. We've been saying for weeks, I don't know if I see the upside to Toby Couchman coming back and putting his body, through a lot. He's had 3 shoulder instability events so far this season. So, look, I would think maybe limited minutes, but more than anything, he's a risk of aggravation. So probably limited minutes in the terms of he might cop a knock and then be out again. So what are you, even from a draft perspective, I think that's what this question is probably leaning towards. Would you be interested in either of them, or probably not enough upside?
No, I don't think so at this stage. I don't see either of them going back to starting roles either. I think Toby Couchman will probably be put on ice when it's all said and done. And Matty Nicholson, I think, will be graduated fairly slowly because he's been missing for around about 12 weeks now, or maybe even a little bit longer from his syndesmosis and fibula fracture, hasn't he? It's been a long time. So I think he'll probably need a bit of time to get some Ks under his belt. Next question, Brien, is about Victor Radley. Have you seen the talk that he had about his dizziness training that he's doing? What is going on there? What do you think's happening there?
Yeah, mate, this is an interesting one. So I think he's spoken about it on a few different places. VOMS training, which is vestibular ocular. Oh boy, this is
Ocular
testing
motor,
me.
sensory,
Ocular
something like
motor
that.
screening. Yep. So look, effectively it's eye movement training. Because that can kind of especially your vestibular system, and we could do a whole thing on that. But effectively, it's dizziness is obviously a symptom that you can get with concussions and those kind of things. And they find that eye movement training can help with those kind of symptoms and help with dealing with those kind of things. So I think, and I mean, if you're watching on YouTube, it's doing things like looking at a fixed object and turning your head side to side. It's doing tracking of a fixed object, tracking of the fingertip and stuff like that. So just doing a whole bunch of training of the brain. The brain is you say at the end of the day, the brain is muscle. You can still train it just like you can train a hamstring or a knee or whatever. So he's just doing some brain training exercises, which is wonderful. You love to see it. It's evidence-based. You want to see more of it rather than, and he did say on Hello Sport, props to him. They said, there's nothing really going on with the headgear, hey? And Radley said, no, there's no evidence that it helps. But he's at this point, I know, I accept that it doesn't help. I accept I've got to, work on my technique and different things. But he's why would it hurt? It's not hurting me. He's not going out there thinking, and that's our thing with headgear is if you put the headgear on and you go out thinking you're 10 foot tall and bulletproof, then it can hurt. But if you know that it's more than likely not going to help you and you still got to work on other stuff, then it can't hurt because it's still going to protect you. As we've said, headgear, we are pro headgear for certain things. And yeah, so I think he's all on top of those things.
Yeah, nice one. Next one is in a similar vein. How did the head knock detection mouth guards work, Brien? I haven't seen these. So What brand are we talking here? Do you know?
Yeah, I'm not sure what brand, but they're effectively like a little mouth guard. Well, sorry, a mouth guard that has like accelerometers and like gyroscope
It's
things in them.
accelerated
And
acceleration. Yeah, okay, gotcha.
yep. So they measure the forces. So they don't exactly like it's not like some magic HIA headgear that every knock there's a concussion, but it's more like it can measure. It might, there's studies out there that let's say 90% of hits to the head over 20 newtons of force or whatever it is cause concussions, and that's what they've kind of seen. So then they know if a player suffers and the accelerometer reads that, then they know they probably need to come off for a check. And then the biggest thing or the biggest benefit to them is not only from a accelerometer, from a concussion standpoint, it's also from a cumulative load on the brain over time. So those little knocks in training, in games, over time, we can kind of look at a season and go, okay, how much load has this person's brain gone under? And it helps with management moving forward. So yeah, not something that's going to diagnose concussions necessarily, but something that can, I guess, help in the management of concussions is probably the biggest thing.
Lucky last question, Brian. As it stands right now, who are your top 5 picks for draft format next year in SuperCoach?
Mate, that's a good question. I think we've spoken about it. I don't think there's been many first rounds that have been worse than this year. So many people have been bad. I think Cleary's a lock for pick 1 for me. Dare I say it, Tom Trbojevic, if he's picked and fit playing fullback, he's in there for me again. Teddy has to be there. I think Mr. Consistency, he just looks so good. Then you're getting Kalen Ponga, probably depends on who his coach is next year. If it's, say, a Josh Hannay, he would be an absolute lock for me. And then, fifth, mate, I'm still not going to pick a forward in the top 5. It's just not going to happen for me. So I'm probably still going to shoot for the Stars and hope for maybe a Latrell or a Scotty Drinks. I think is probably at pick 5 for me, depending on how the Rabbits are looking health wise. But yeah, it's probably Scotty Drinks, but I think Latrell's there and abouts. Have I missed anyone obvious there for you?
Prince Nico Hines would be 1 for me. I think, Nico's probably 2 behind Cleary. I think Cleary 1, Nico 2, Drinkwater 3, and then I wouldn't have Turbo in my 5 this year, to be fair, mate. It's been roasted a few times, and he's friend of the show, but I can't go back there again next year. I think he's got to be a late 1 at best if you wanted to look that way. So I think, what have we got? So we got either Ponga at 3 or Paps at 4, Ponga at 4 or Paps at 4. I could sort of hear an argument for them interchangeably. Probably Teddy outside the top 5. So I think Ponga and Paps would be the other one. Paps with the goal kicking, his ceiling's so high. The injury risk is there though. So I could hear an argument.
I
for him
forgot
going
about
later.
Paps completely. So he'd be in there. Yeah.
But Paps I just like his ceiling is so big, and he's put a few games on the pack this year, but he's always going to be soft tissue injury risk. But I think, those ones are the big ones for me, I reckon, mate. Payne Haas probably a tough miss because, man, with the offload, he's a cheat code in SuperCoach. He's the only one I could sort of say, Payne Haas would be a one to consider at 5. I wouldn't be against it, that's for sure, as a Broncos mega homer.
Love it, mate. I love it. All right, let's get into SuperCoach Corner, mate. There needs to be some things happen here because my team did horrible this week. But someone who's going to help me do that is the SC Ballers, mate. SuperCoach head-to-head finals are just around the corner. If you want to sharpen up and make the right call when it counts, trades, captains, your 17th man, you'll need the right tools. And Baller has projections, base plus power stats, captaincy and ownership data, and everything you need for SuperCoach strategy. And it's all free. So just sign up at baller.live and get access to every tool you need to finish the season strong. James, the stuff they've got over there at Baller is kick-ass, eh?
It's very good, Brian. And for people like me who is on struggle street trying to get a captaincy right every week, the projections make a huge difference. I've got to say that. Even this week, I think the example we have here is that Nathan Cleary was projected to score 102 this week with the goal kicking, and lo and behold, what does he rack up? A big old 119 on your head. So me and you both missed that as well because we are idiots. But it's one of those ones that you can use the projections to your favour, especially when you're trying to look at VC and C options. And for me, Brian, it's been my Achilles heel for ever and ever trying to get a good score out of a skipper. So definitely Baller.live. The projections are very, very good. I think they're far better than what you see on Supercoach Gold, that's for sure.
Oh, 100%, mate. I think like the best thing about their projections is they're built on using like 5 seasons of detailed like Supercoach data. They contextualize it with position, opposition, weather, venue, all that kind of thing. Like, yeah, they actually base it off of relevant stuff. Sometimes you look at those projections on the Supercoach app and you're like, where the hell have they pulled that from? And I think this stuff is just so much more in depth. You know, it's coming from the right place. They update it weekly. Yeah, that it just reflects how the game is played, I think, not just what happened like last week or the week before, which seems to be the Supercoach app. So, yeah, it gives you insight, not just numbers, so you can make smarter Supercoach decisions, which is great. So, mate, how are you going to make smarter Supercoach decisions this week? What are you going to do? We've both got 2 trades left. I reckon we've got to, we've got to burn them to try and catch up in especially if nothing else, the run home challenge.
Yeah, we're going to make some moves for Run Home Challenge. So this week, 13-13 for me. I skipped Nico Hines, sadly. And I VC'd Angus Crichton because I just thought he's due for a try and I needed to VC someone from that first Thursday night game. So if only I went headgear Harry Grant, Brian, that would have been a much, much better play. And I could have looped that big old 113 that he put up this week. So sadly as well, I left Zach Hosking, Jesse Raymond and Colin Tracy on the pine. So story of my life, just leaving guys scoring big on the bench. So what I did was I traded out Keon Colomatungi this week for Angus Crichton. I hope that he can go big for the run home. He's not highly owned, so hopefully he can start putting up some big old points for the Roosters. He's definitely due some attacking stats, Brian, isn't he? He's normally better than this as the years go through. And then the second trade I was going to make last week was I had Nathan Cleary in for Connor Tracy through the flex, but then I reversed it with the Jahrome Hughes news. So this week I'm going to trade Cleary out for Hughes directly in a 7 spot rather than a flex spot. And then I've got one trade left, and that final trade will probably be on a front row or a second rower because I've lost Jaydn Su'A to injury. And then when Zach Hosking goes on bye for the Raiders, I won't have a second row spot available. So unless I want to trot out Tony Suka in second row, then my second row stocks are very, very slim. So I'll probably just do the Cleary in for Hughes this week and then hang on that one for if and when I need it at the back end there, Brian. So that's what I'm going to do. I think there's some pretty good little centre wing options that are lowly owned. I know Ronnie Mulatalo went good for me this week. He's still 4% owned. Jesse Raymond's only 1% owned. Taylor May is 1% owned. He's looked good in base and power. If you've got some trades there at 444. So there's a few little options there. Jaman Hopgood's getting some minutes at second row now. Like you'd want to see him getting slightly bigger minutes, but he's basing out well. Isaiah Yeo, missionary Isaiah for us, scored really well this week with a try assist in there. There's a few good guys that are shaping up. So if we only had more trades, Brian, we could do some damage. But alas, we do not. So what are you going to do with your final trades, Brian? And how'd you go this week?
Yeah, mate, 12:03 for me, so a real down week. I captained Nico as well, which did not go well. I was exactly the same as you. So after the Hughes injury, I reversed my trade of Asako out to Cleary because I'm like, well, I need every healthy body that I can. So I'm going to do Hughes to Cleary this week. Mate, I think trading in To'o instead of Edwards like 2 weeks ago has cost me like 400 to 500 points. That has been an absolute killer. So yeah, don't remind. No, everybody needs to remind me in future years if I ever on this show talk about trading in a Penrith outside back. I don't care. Like, just don't let me do it. It's just my kryptonite. It does not go well for me at all. So I still got one trade in the bank. I probably maybe want like a Hudson Young, but he's got a buy, and I think for somebody in my position where there's like my guys are not looking good a lot of weeks. If I cop an injury or two and then I've got Hudson Young on bye, I've got Joe Tapine on bye the same week. I don't know whether I can do that. So I'm eyeing off like maybe Isaiah Yeo, missionary Isaiah Yeo, or see, I could go missionary Isaiah Yeo, or I could go like the, swinging Lotus Aleka Halasima, mate. Like get
Now we're
some
talking.
I wanted the affirmation from you to tell me that I was on the right path there, because I'm definitely heavily considering him. I didn't look to see if he played 80 this week, But if he did, and like maybe if Cody Capes needs a week off or something like that, yeah, Halasima, maybe Vaimauga might be out for a couple of weeks. If that's all kind of lining up, boy, oh boy, Halasima might be coming into my team. But I still am considering, as strange as it sounds for me now, I just don't love the fact that because I've run out of trades effectively, I kind of have to play a CTW at flex now. Like it'll be Hughes out, and then I've got to decide whether I carry who am I carrying? Kaloa Matangi and Dylan Lucas in the front row. And I've only, in the front row, second row. And I've only really got Joe Tapine to kind of cover me in both of those. So I've got no second row cover effectively. So I think I probably need a second rower, but also like I'd love to get another fullback in my flex spot. So that's the breaks of burning all your trades, James. So maybe I just do it and run the gauntlet at second row. And if I lose second row, I just AE it for the rest of the year. I don't know. But yeah, that's kind of where I'm tossing up at the moment. But yeah, Halasima definitely piques my interest, even though Hudson Young knocks out 90s for fun. It's a tough one, mate. Where would you be sitting of those three? Like a Hudson Young, Yo, Halasima? Who do you reckon is the best option, knowing my predicament at this point in time?
Yeah, it's still probably Hattie Young, isn't it? His scores have just been so immense this year. Faraday's been good. But Halasima, he's young and hot and very good at rugby league football. And he's had, honestly, Brian, if you put his highlights together this year, it would be on par with a Matty Belin YouTube circa 2010 highlights package. Like the things that he's been able to do this year has been unbelievable. But with Isaiah Yeo, he's gonna average out 70 for the rest of the run. So there is that as well. He ticks up a bit more when he gets a bit of attack in there too. So I think they're all good options. The Halasima is very vibey, and the Warriors have a very good run home as well. So he'd be one I'd be sort of eyeing off just in terms of the run home, plays every game. They need to win out to secure a top 4 as well. But I'm in the same spot as you, rotating a centre wing through the flex for the rest of the way. Like by the time I get Cleary, I probably will need to just hold one for a second row. But if I do go away from it, I could probably bring in another fullback. But at the moment, my centre wings are who have I got? Karaz To'o, Mulatalo, Ramian, Connor Tracy, RTS, and Zach Lomax and Karapani. So including that one through the flex, it's really Karapani that's probably the one I don't want the rest of the year. The other guys I'm happy to play on matchups, and the Sharks I've got to get through one more bye. So it'd be better to get a fullback, but I just don't think I will. I might have to just use one at second row or front row, I reckon, when it's all said and done, especially with Payne Haas a bit up in the air. Obviously Jaydn Su'A gone now for me. They're two spots that might be a bit problematic.
Yeah, mate, it's not a good time to be in the fear factor mongers at the moment, unfortunately. But anyway, we will survive. We'll survive, and we'll move on, and we'll give this run home challenge a red hot crack. That is a wrap for this week, guys. If you like the pod, give us a review, recommend to a friend. James, next week we'll have to update everyone on the draft leagues because it'll be going into finals. So we'll update everyone on the Magic Sponge Invitationals, of which you and I are both looking like making the finals of one, but not with our good teams. I think it's our shitty teams that are going to make it. And then the other league where, it's just the fun of draft. But anyway, guys, thanks for listening, and up the mighty, mighty Redcliffe Dolphins.